7. Talk too early. Oh, indaba. Talking my business isintu. Nazo zonke indaba zabasha.
Welcome to iConversation yethu. I'm sure sewuyabona now ukuthi noma yini esuke ikhulunywa, you can get it here on our platforms, and the beauty of the app ukuthi uyakwazi ukuthola even videos like this one, and you are able to get on a podcast as well. Alex Mtiana here, welcoming you for the first time Glamour Conversations esizoba nawo, first installment for 2021. Of course, there is a talk, the panic following the impact of the COVID-19, business, even the public health sector, in fact, not even public. We health sector in general, they're feeling the strain, even as some business in. So today we are looking at the impact here, this COVID-19, this second wave. We're asking basic questions that mina now esingakwazi ukuthola wona. Sometimes there's so much information esithola in the news, and then we don't even get isikhathi to catch up and ask ukuthi kwenzakalani. And the worst thing we can do is to assume ukuthi us as ordinary people, we understand what's going on. So I'm introducing my guest who's going to take us through this. You are welcome by all means to have your comment and ask questions as well. I have Dr. Veli Lengidi, uvela KZN as a public health medicines registrar.
Yes.
The title in there, so I got it right.
Yes, you got it right.
All right, it talk about the second wave, and it's looking on from the past year that we had, ngesikhathi saqala COVID-19.
Well, second wave ihluke ngendlela ehlukahlukene. Ngingasho ukuthi kuhlukile once sine experience as healthcare professionals and as a healthcare system. There are also now more treatments that we are able to use to assist with treatment and care of abantu who are affected.
Yes.
But I think also we are aware that the virus has adapted a little bit. When we talk of a variant, which is now more infectious than it was before.
Yeah.
But I think also with all of those dynamics is the fact that the numbers are much higher. And I think it's not just South Africa, it's the trend that we're seeing globally, where you see certain numbers in the first wave, and in the second wave, they're generally higher. So this is the trend we're seeing in South Africa as well. So maybe people can ask themselves, why is it different, the first wave and second wave in terms of numbers? But I think if you think, if first wave, if you're figuring about much, which in a culture like ours, South Africa, as far as human behavior and the social activities, end of the year where the second wave reached us was a time where we used to socializing. And unfortunately, we had tried to persevere in the first wave with all the hand washing and physical distancing. But what we've seen, people got tired. So sazama ukuyimisela the first wave, but level lokuyimisela ngathi ayisaphakeme njenga how we've seen it before. So I think logo level of relaxing, what ama expert call pandemic fatigue, okusho ukukhathala okuhambisana nokuzama ukuthi adapted to new conditions over a prolonged period of time is what we are seeing. So ukuhlanganisa lokho ukuthi abantu bakhathele, festive season, people want to visit, people move between provinces, they move from provinces where they work to provinces where the home is.
Yes.
And then, you know, especially we talk about younger people who are economically active. So when they're infected, most of them won't even know. So now they come back and they bring this infection home unknowingly to elderly family members. So these are the dynamics that we find ourselves in with the second wave, and then add to that the variant that is more infectious.
Yes, it's interesting what you mentioned that, because now as January, people are at the provinces and districts, they are coming back, and soon we will hear of tertiary institutions as well. At present, we are sitting at close to 88,000 positive cases, and then death nearing 5,500 where we are. At first, abantu vulnerable were abantu age group amadala, but now, as you say, sibona youth nayo kuba yiyona esi-infecteka kakhulu. Explain that to us, so sneak as a context.
So, into we-youth, into ebaluleke kakhulu, thina abantu esibaziyo, esibabaka ama-numbers, abantu who present and test. So that's one thing that we need to note. So the numbers that we're seeing, chances are nothing compared to the numbers that are actually out there. So because of the mere fact that youth, when they get infected, they usually suffer a milder form of the disease to a point where they won't have symptoms and they won't know that they're infected. So they won't come to present and test. So we have been in a way then under the impression that youth is not affected, but the youth isn't actually affected. They are getting infected. It's just that they're not getting as sick and they're not presenting into hospital, like what you see with abantu abadala. But we mustn't forget that also abantu abadala, the reason why we feel that they're getting infected and getting so negatively affected by the disease is because there are comorbidities, what we call underlying chronic medical conditions, hypertension, diabetes, and those kind of diseases, they usually set on later on in life, which is why now it seems as if it's the elderly, but it's more those comorbidities that are actually contributing. But it's important that we've got youth who have got chronic medical conditions, and they are also now presenting as individuals. So it's HIV. You're looking at TB. You're looking at overweight and obesity. These are all conditions that we are seeing in youth. So we mustn't actually think that youth is not necessarily immune to severe disease.
Right. From understanding yokuthi lesi sifo sizohlasela kakhulu abantu abadala to the information esesizwa right now, and there is a lot. I think in a day, how many forwarded messages do you get on WhatsApp or even on social media? And it's so easy for ukuthi umuntu athathe information engekho verified and engekho official, and then ama-theories akhona bayidlulisele forward. Any questions you may have, please poster here. You can have your comment as well. Enye into esididayo la Dr. Ngidi ile isolation versus quarantine. Is it the same thing or an issue of on yaga medical science? Please explain the two.
Okay, quarantine ne-isolation ngokwenza what we actually isuke siyenza iyafana ngoba i-idea kokona kokubili sizama ukuthi sibambe infection ukuthi ingabhebhetheki kubantu aba-infected or abantu angasekwenzeki babe-infected. Kwi-quarantine shuthi umuntu okuwukuthi ube nezimpawu bayakotesta ulinde imphumela.
Okay.
So lo muntu kunokuthi kungenzeka ukuthi u-infected kodwa sinayisho loyo uya kwi-quarantine. Kodwa imithetho kwi-quarantine izofana, akudingeki ukuthi uhlangane nabanye abantu, fanele ube sesimeni la ungezothelela abanye abantu khona, ube serumini egumbini lakho, ungashare into zokudla kanjalo kanjalo. Kanti mase sikhuluma nge-isolation isibuyile-ke manje imphumela, it's positive. So manje awusekho ku-quarantine, usuku i-isolation, indlela esihlukanisa ngayo kodwa imithetho iyafana.
Oh, okay. Right. I've been with you for more than 10 minutes or so, and ngibuka ispace. If oyedwa wethu between mina nawe was positive, how are the chances? Ngibuka lesi space esikusona. Indawo esikuyona, it's almost the size of a normal lounge or an office esherwa abantu. Ngizama ukuchecka la ekutheni ngivuka ekseni ngizodlula e-taxi rank ngizoya esitolo ngizothenga ngisemsebenzini, it's the open plan. Lisuka kanjani igciwane? Lisuka emoyeni or mhlambe ngeke ngathinta le glass now busu uyayithinta? Let's go to the basics because you'll be surprised ekutheni abanye abantu bayi-interpreta kanjani lento.
Ngidinga nje ukuthi ngiyidefende kuqala ngoba ngizigazi ukuthi ngifike ngigqoke imask ngoba asiwagqokela amask ngoba siyaxoxa.
For this, yes.
Kodwa akudingi nokuthi uzucabange wasekuseni manje ngoba obe exposed kona ekseni ngeke uze benemthelela manje ngoba kuthatha isikhathi ukuthi igciwane lingene emzimbeni multiply. Kodwa izolo nakuthangi na 10 days ago when wenza ama-activities ngokufana. So into ongayifuni ukuba eduze komunye umuntu within a meter for more than 15 minutes.
Okay.
Ilo ongakufuni whether outside or indoors. That's why physical distancing fanele be more than a meter or more. But kodwa kubalekile futhi ukuthi ungaba more than a meter sikanje. Kodwa manje sihlele endaweni engena ventilation.
Okay.
Asigqokile ama-mask. Leyo nto ukuthi-ke leyo distance isuba nomthelelo ongekho omkhulu kakhulu ngoba manje besikhuluma nje ayagcwala ama-droplets endlini sogcina siwaphefumula sonke. Okusho ukuthi kunaloko ukuthi kune-distance but also kune-level of ventilation, kunama-conditions la. Kodwa physical distance is very important ukuba indoors nabanye abantu fanele ube kwindawo well ventilated, vula icaphu, vula amafastela, uyasiza.
Okay. I saw a question here yokuthi why if umuntu esemotini eyedwa kumele ukuthi ayifake i-mask, and people were asking ukuthi but angikho at risk, angikho in fact nje kuma roadblocks esasiwabona well, the cops babe indicator even umuntu driver eyedwa emotini ukuthi kumele afake imask. Why?
Uma uyibuka kanje isizathu sifaka imask ukuthi nje masikhuluma lama droplets olamacunsana amathe ayafafazeka. Kodwa afafazeka futhi mesihlala kuma surfaces. Okusho ukuthi uhamba wedwa la emotweni uyaphefumula mhlawumbe uyakhuluma nomngane wakho ocingweni ukuyi loudspeaker la. Uyabona amathe ayaphuma which means you contaminate ama surfaces emoto. The next thing ukuthi umngane wakho ayengizokucosha endleleni. Mase umngane wakho uyangena la seniyangena niyakhuluma noma efaka imask useyabamba la ubamba la ka hand sanitizer. So lento lena ayikho emoyeni kuphela ngoba lama droplets as much as basemoyeni but they also land on ama surfaces. That's why kuthiwa fanele belu clean ama surfaces njalo ngoba akona kuphela through inhalation or ukudonsa ngomoya okubanga ukuthi uthole leli gciwane. Uma mina ngizobamba isurface la ama droplets or amacunsana la wahlale khona ngizowacosha ngezandla mase ngixixa amehlo. Ngithinta umlomo ngidle. So leli gciwane liyangena ngalezo zimpawu. Ngiyacabanga ukuthi nanokuthi kus-encourage nje ukuthi ama-good habits ukuthi le mask nje kube natural thing to do whether we're in the car etc.
All right. Sure. All right. Udokotela uvelile ngidi, and we will be reading our comments and taking your questions as well. And this we told we app here to please download it for free. And again, uzobona namanye ama conversations that we've had before, and I'm sure sewazi ukuthi ku Gagasi FM we have these conversations go on our platforms. Yes, the conversation yethu iyaqhubeka. I invited you to sneakers again my questions nama comments as well. Uzonothisa ngesikhathi esiqala besiphuza nje amanzi and bebanda. And then now it's cappuccino and coffee. I see kunama questions cishe awu-3 avelayo la doc. People asking ukuthi at first the advice enanisinika yona kwakuyokuthi leli gciwane lihlala kakhulu endaweni ebandayo. Now that we are in summer, sekuthiwa manje ngoba kuyashisa libhebhetheka kakhulu. Usinikeze i-perspective right yokuthi lihlala endaweni ebandayo or endaweni ewarm.
Okay, into ebalekile ukuthi understand ukuthi beginning of the pandemic we knew very little about the virus. And whatever was being said was speculation. But I think we needed to see as it progressed the pandemic with what was really happening. Because I don't think anyone at the time when it started out in China knew much about it. We knew it was a new type of virus. We knew it belonged to a group of viruses that we already know, like flu. But over and above that, whatever speculation we had done then was based on understanding the group of viruses. But this is also a unique virus. But over isikhathi, we realized that come summer or winter, transmission continues in other countries. We saw that in Europe and in the United States, and so we're seeing it in South Africa.
Okay. All right. So kushuthi ke engikutholayo from ukuthi whatever information esinikezwayo kufanele ukuthi siyithathe and singabambeleli kokudala. Udokotela uthi at first bekukhona leyo. Now kwamanye ama questions la. And then I see omunye la ethi nombuzo la umayelana nomuntu mangabe suke sedlulile emhlabeni. Leli gciwane lisuka nini kuyena? Ngoba usuka esibhedlela esegoqwe ngoplastic wakhona angene emakhazeni akhona esibhedlela afike kwimoto yasemoshwari imthathe iyomfaka kwi-fridge ahlale khona izinsuku. Uma esezophuma ibhokisi liyathathwa kwenye indawo liyiswe libe livaliwe. Manje leli gciwane liyakwazi ukusuka ngaphakathi libe ngaphandle kwebhokisi. Uma likwazi ukudlula ebhokisini siuthemba kanjani kuplastic lo ofaka umuntu mangabe suke seyisidumbu? What about labantu abahambisa idumbu bona baphephe kangakanani? Uthi ke unendida la uThokozani Nyambosa.
Okay, so i-idea kahle hle ukuthi I think njengoba bengiye ngachaza ukuthi there's a lot that we still don't know about the virus, and i-idea we do know ukuthi liya-transmiteka through ama surfaces aka-contactwa umuntu onalo infection. Kodwa ukuthi ke like in a human body, ukuthi how long it would last and survive, it's something esingayazi. So what's happening is we are erring on the side of caution.
Okay.
Ekuthenini rather kube over caution then. So what happens emamoshwari when they do put bodies in the casket, they are supposed to practice ama-infection prevention and control measures azokwenza ukuthi ultimately plastic lengaphandle fanele kube ukuthi there's no more virus on it.
Oh, okay.
Because that is what is going to be sent out to the family.
Sure.
Kodwa lona alizokwazi ukuthi lisuke ngaphakathi through the wood and all the way out. So it's all in the preparation of ibhokisi before the families come.
Okay, sure. I mean, watching this and usebenza emakhazeni, please note that. And then kunama questions ke amaningi amanye ngizosummarize like first one evela nje kuThulani asking la ukuthi kuyaxaka ngoba iSouth Africa ayinamali this 5G is not urgent. Sisanda kuthola i-4G. Why kuphoqwa ukufakwa kwe-5G? Kusobala khona umshikashika ophushwayo. I-4G siphelile ngayo, ayinankinga saphila. Why manje kuza i-5G? Ngoba sixakwe ubhubhane. I want to also get another question about indaba ye-5G so that uzophendula kanye kanye. And then uthithukani ngubane uthi ke there is too much confusion ukuthi 5G ihlangana kanjani nale corona nokuthi babethena ehlobo lizoncipha. You've answered that one. So uhulumeni why angayimisi i-5G kuze kwehle i-corona?
Ngicela nje ukuqala ngokuthi I'm not an expert ku 5G, kodwa I do understand how a virus gets transmitted. As to why government is deciding to roll out the 5G, I think I'm not an expert in that field, but I think there's been a lot of misinformation about the link between the 5G and the virus, whether it's the 5G and the actual virus or the 5G and the vaccine. Ngoku-understand kwethu i-anatomy and biology and infection and transmission, E5G is almost like an invisible radiation type of transmission. And in my mind, as a healthcare professional, I don't see how the virus can get into those waves and gets transmitted. It's not the kind of infection transmission mechanism that we know.
Yeah.
So I think in Zagala, unfortunately, everybody has access to social media and everybody can go on social media and speculate. But we need to learn to differentiate between expect opinion and abantu beyixoxela nje and having just those conversations. And I think it's important with abantu bazi ukuthi where to get accurate information.
Right. And then bese kuzoba khona ke enye question la ngizoyifunda nayo evela kuBhungane. Umbuzo omayelana ke nemvela phela ligciwane kuyise-Wuhan okuyi-district yase-China. Ngokuzwa kwami ayifikanga eBeijing nase-Hong Kong nase-Shanghai kwezinye zeyifunda zama-China. Uma yahluleka ukuthi icrosse i-border to ama-district ase-China, ikwaze kanjani ukuthi igxumagxume ize ifike kwi-continent yethu? Note that, Doc, because there's another question like it looks like South Africa iyahluleka ukontrola this virus because in fellow African countries isibalo sakhona sincane, but if ubuka la eSouth Africa thina siyakhula, and into engibona ngazi ukuthi ingcono yokuthi asisebenzise umhlonyane lo owamaZulu. Two questions there, Doc. How do you respond to such?
So leyo kuqala ekhuluma ngokuthi why in the countries in China, why transmission was not as bad as it is in South Africa. Uyayibona ukuthi there's a lot of theories. The one is, if you understand how the virus is transmitted, you need very close cooperation or collaboration between citizens of the country and government. And makutiwa hand washing, physical distancing, you must go and test symptoms. You must quarantine when you are actually waiting results. You must isolate when you are infected, and you do as you are told. This is critical. So this is what we believe that could also be a contributing factor why China, they were able to get on top of the infection quicker, because in a way, South Africa citizens is like negotiable. So makutiwa, you cannot be out and about when you're supposed to be quarantining. You cannot be out and about when you're supposed to be isolating. You cannot be out and about without a mask when you're supposed to be wearing a mask.
Yeah.
So these are the things that we're looking at. So it's about collaboration between citizens, because controlling of transmission relies so much on individuals doing their part.
Yeah.
Each and every one of us. And I think this is the strength these countries have over us.
Right. And on Dr. Lukhuluma ngendaba yaka social media and ekutheni sithola ama-casualties of misinformation. Now, the images that we see, whether they are video or people benza ama-personal accounts, ama-stories of us failing and singa-survive. How can young people be ambassadors by spreading ama-messages about izinto kumele zenzeke, and also people telling us how they survived? Siyabonga. Ngizothatha some of the comments as well avela, because angifuni dokotela ukuthi sigcile kakhulu kuma questions kuphela. Khona nama comments are positive that I would like us ukuthi singene kuwona on the other side of this. All right, before we wrap up with Dr. Ngidi, ngizofungena nje kuma comments. I noticed ukuthi khona nama comments la dokotela ngaphandle kuma questions as well. And uNtando ngizofihla isibongo sakhe. Is saying la ukuthi le COVID kubonakala singazi ukuthi mangabe ithatha ekhaya ithatha abantu nga2. Ubaba ubengahlukani nemask and ubehlala eseduze kama, but mangabe esengadini ubeba yedwa, but bobabili bebawafaka ama-mask, kodwa we buried both of them. Asazi ukuthi iqhamuka le COVID. Ngiyofisa ukuthi uphendule to that, Doc. Please note it. And then bese kuzoba uThulani Matshabela saying ukuthi i-challenge esibhekene nayo as a country yile ndaba esizwayo i-5G and the way government enza ngayo, not enough has been done to raise the awareness kunalokho besisatshenziswa ngamasosha namaphoyisa if bangasebenzisa the strategy abasebenzisa ngesikhathi se-pandemic ye-HIV. And then bese kuzoba u-Emmanuel Dlangisa ethi ngiyafisa ngazi ukuthi mangabe sithola abezempilo odokotela nama-experts sithole futhi nomuntu ozochaza ukuthi idalwa yini lenkinga engaka, sithole ke nabe zangoma nenyanga as well ukuthi sizosichazela ngoba khona ukudukiswa okukhona kulokho kumentionwa indaba ye-5G. Then bese kuzoba uNkululeko Lwandle ethi ngiyayizwa indaba yokuthi abantu bayagcwala ngenxa ye-corona esibhedlela, but akaze kube khona ngisho oyedwa kuma-politicians ethu okuthiwa udlulile ngenxa yalokhu, ungazi ukuthi khona abasifihlela khona. Ngizokhumbuza masukhohliwe nawo ama-comments Dr. Ngidi.
Ngicabanga ukuthi engihlukumeze kakhulu ile kaManu baba bahamba kanye kanye nakona siyayibona vele i-trend common. Into nje efanele siyazi ukuthi out of 10 people who test positive in our province, 9 would want to isolate at home, which means we've got people who are possibly quite infectious, but they are at home.
Yeah.
It's critical ukuthi ba understand imidanti or imithetho fanele bayilandele babesekhaya.
Yeah.
Ngiyazi ukuthi i-Department of Health ikhiphe ngisho guidance of how to isolate and quarantine safely at home. And we must not underestimate ukuthi how difficult it is to control the transmission. That's why we much rather have people be quarantined, be isolated kuma health facilities government where they are separated from their homes. But we do understand that people are quite reluctant, especially when they don't feel sick, to be taken away from home.
Yeah, kuba sengazi ukuthi ngeke ngibuye ngiphila.
It's like a sacrifice that's not
Yes.
that's not justifiable for them.
And then there's a concern la yokuthi i-awareness umlaleli is saying that government is not doing ngendlela ayenza ngayo ngesikhathi se-HIV.
Singasho ukuthi maningi ama-lessons esiwafundile from HIV. As it is, we know that kunama non-governmental organizations that are working with HIV that have also moved towards the response COVID. Lessons, maybe it might not be apparent in the public, but I think there's a lot of collaboration behind the scenes with Abantu Baglama programs because it's the same managers that are managing the same very response to COVID-19 that work with HIV, and it's the same NGOs that are doing. So the whole thing with contact tracing, we learned even with the HIV, where you had to disclose Abantu who might have been in sexual relations with you so that they'd be able to be approached and tested, etc. So we are using those lessons, but I do agree that we could possibly do better.
Right. Now the approach as a father, even the traditional healers, is that happening?
Okay, so I can't speak on behalf of the state per se. Kodwa, I think it is a good idea that some traditional healers are involved. I'll give you a perfect example. Ansi siyazi ukuthi COVID is very infectious. And we know KwaZulu-Natal abantu bakithi chances abaqala kuma traditional healers first before they go to a bedlet. Which means masikhuluma ngo frontline, they're just as much of a frontline as obonesta bodokotela. And if you imagine maybe umuntu ogulayo vele sehefuzela angene in a treating heart or iqhugwane la umlaphi asebenzela khona amafastela wekho mhlembe bahlela 2-3 hours lo muntu akagqoke mask uyalashwa. So kubaleke kakhulu ukuthi bekhona an active involvement ama traditional healers, but personally, I'm not yet aware of any kind of collaboration.
So if government is going to prioritize, as we know, a vaccine, frontlines people, so traditional healers too, this may sound like advocacy for them, but yes, we have indaba yesintu here unapologetically, so I would support that. So young people as ambassadors and being responsible and taking an active part la, your message so uzwile rather ulayini ukuthi ukuphi, one with regard to the theories and again ukuthi sazi kangakanani about this, your message having listened to this and interacted with our stakeholders being we educational institution as well.
So I think we were having an informal conversation before we started, and I jokingly said, I don't know, maybe I'm too old, but there's a movie, I think, Lethal Weapon. example, actually youth are the leader weapon for
Yeah.
this pandemic.
Yes.
Why do I say that? Because one, they are very social beings. They are out and about. They get infected. They don't get seriously sick. So which means in actual facts, they become key in transmitting infection from one area to another because they are mobile. Then they go home to their loved ones, the elderly loved ones with other medical problems, and that transmission. And when I think maybe we are not making the link as a youth, but we need to make the link very quickly. Otherwise, we're going to end up losing our loved ones as a youth. And it's so critical that they understand that.
Okay. Ngeke ngidedele Doc ungazange uphawule kafushane about indaba ye-vaccine. Things okumele sizazi about it. Because there's a lot okushoyo kwe-panic, but people are saying izinto ezihlukahlukene. So it is the only hope esinayo, right?
Well, it is one of the things we can do.
Yeah.
I don't want to say it's the only hope because non-pharmaceutical interventions, hand washing, physical distancing, staying at home when you're sick, going to test when you have symptoms, quarantining when you're waiting for your results, and isolating when you're infected. Those interventions, they work if we all do our part. So I don't want to leave people without hope as if until the vaccine comes, we've got nothing else. Those interventions, they work, but we do know, Wuti, we've had to sacrifice a lot economically and otherwise. People have lost jobs because we had to immobilize our communities and put them under lockdown. So we don't want that to continue. We don't want people to lose jobs. So we really do need the vaccine. But I think it's also important that we understand that vaccination akuyona into entsha. Vaccines, we've had vaccines. I've had the TB vaccine as a child. We've got amakhadi lawo road to health chat abantwana abancane baya vaccinate. Indlela efanele sibuke ngayo abantu mabethi le vaccine iza nobungozi bafuna ukusibulala amaphilisi nemjovo siyayidla already. Kwezinye izifo uma ukuthi ngempela there was a reality behind ukuthi there is a conspiracy, they want to kill us, they want to do this, they're going to put this poison in this vaccine, just think about it rationally. Cabanga nje kahle ukuthi if the people, our countries, maybe our Western countries wanted to kill us, they can put all of those poisons in the medicines that we're taking already because we don't know where they were made, but we trust them. In the injections that we're taking, we're already giving our little babies our vaccines that come from these very same countries. And our children are surviving. And we know that when our children don't take these vaccines, they get terribly sick. I mean, this is like a measles. The measles is fatal to children when they miss the vaccination. And we must just go back to what we know as factual. And then we move from there. And when we don't know, we ask abantu that actually have accurate information. We've got Umnyango Wezempilo, we've got about WHO, we've got about CDC. Lezinda was the corner where you can get accurate information. When you interact with your doctor, your nurse, ask because there's too much of fake and misinformation on social media.
Right. As an expert or independent, what is in the news from the weekend? Let's Ivermectin. And it's banned in South Africa, which is dispensed to the public. What do we know about it?
So Ivermectin is not a new drug. It's an old drug that has been used globally as a treatment for parasites. Like you should see infestation it was not licensed for use in South Africa. So it has been used in humans, but not for COVID, but for parasitic infections in other parts of the world. In South Africa, it's licensed for use by vet, which means abodokotela beilwane. Kodwa there is that rumor and there's that unrest amongst the clinicians. Wait, there is a possibility to Ivermectin ingenze ukuthi assist. There is studies are corner that people are looking at. So what we are seeing now is that government is taking a closer look at the research that's out there. Even not WHO, everybody, it's all eyes on Ivermectin at the moment. So there's into engafunakala asifanele siye ngenhliziyo nangokujaha ngoba into ezokwenzeka singakwazi ama-doses are correct and then people will end up dying from treatment with high doses. So Ivermectin, it's in the pipeline, but it's still being looked at by government and globally governments all over.
Sure. Sibonga kakhulu. Igesi yethu Dr. Velile Ngidi, Public Health Medicine Registrar at University of KwaZulu-Natal. Thank you very much for this information, Doc. We have other installments of this program ezayo, and please be on the app Gagasi FM, and if ungenayo, please download it for free go Android and go Apple Store as well, or Google Play. Sibonga kakhulu, Dr.
Kubonga mina, ngibongela abalaleli.
on Mondays at 7. Talk too early.